Can I start the timer?
Yes, I'm ready.
Good. So starting the timer, and here is the question. Right. If you have read and understood, let's begin the session. Can you please identify the structures from 1 to 13, please? This one is pointing at
One
something, yes.
is a submandibular triangle.
Okay. But this is, one is a muscle, if you can identify.
One, okay. This is the posterior belly of the digastric.
Very good. And then 2?
So this is a carotid triangle.
Very good. 3, please.
This is the upper half of the posterior triangle.
Very good. Occipital triangle. 4, please, is again a muscle.
This is sternocleidomastoid.
Very good. Very good. 5, please.
This is the inferior belly of omohyoid muscle.
Very good. 6, please.
Trapezius muscle.
Very good. 7, please.
This is the clavicle.
Supraclavicular triangle. Okay. 8, please.
Okay.
Because it's pointing at you.
This is the,
So 8, please.
yes, okay. This is the anterior triangle.
Or muscular triangle. Because
Muscular triangle. Okay.
9, please. 9 is a muscle.
It is sternohyoid.
Omohyoid. Okay.
Okay,
And then
superior
10.
belly of omohyoid.
Yes. And 10, please.
The hyoid bone.
Very good. 11, please.
The submental triangle.
Very good. 12, please.
Anterior belly of the digastric.
Excellent. And 13.
The submandibular triangle.
Very good. You mentioned certain triangles. How many triangles there are in the neck? Can you please tell me the boundaries and
The anterior.
Yes.
The anterior triangle bounded
Yes.
anteriorly by the midline of the neck.
Yes.
And posteriorly by the anterior border of sternocleidomastoid.
Yes.
And
superiorly
by the lower half of the lower border of the mandible.
Yes.
Posterior
and the line
triangle
from the angle of the mandible to the metatarsal. Very good. Okay. Can you tell me the anterior triangle is further divided into how many triangles?
Into the submental and the carotid and the muscular and submandibular.
Very good. Can you please tell me the contents and contents of each and every triangle? If in sub and anterior triangle, yes, please.
The submandibular contains the submandibular gland.
Yes.
Submental contains the submental gland and the carotid
gland. There are more things in submandibular. Submandibular gland, ducts and lymph nodes, and facial artery and its branches, and lingual nerve and submandibular ganglion, mylohyoid muscle and its nerve, hypoglossal nerve. All these are in submandibular region. Then now please tell me in submental.
There is submental lymph node and submental gland.
And mylohyoid muscle.
Mylohyoid muscle.
What about it? Originates from the body, and where does it insert? Body of the mandible. Okay, in the muscular triangle, what would you find?
There is a muscle, strap muscle,
yes,
sternohyoid, and
yes,
sternothyroid muscles.
Yes.
And there is trachea.
Okay, very good. And esophagus.
Esophagus.
And then thyroid gland and associated structures. What are the associated structures which are found in muscular triangle along with thyroid? Please.
A muscular triangle can be the carotid artery and the vagus nerve and the internal jugular vein and the common carotid artery,
and
branch internal and external carotid artery.
Yes, and
vagus nerve, the hypoglossal nerve.
Ansa cervicalis, internal jugular vein, and lymph nodes. Okay. All right. Can you tell me the boundaries of posterior triangle, please?
Posterior triangle posteriorly by the anterior border of trapezius.
Yes.
And inferiorly by the middle third of the clavicle. And
yes.
Anteriorly posterior border of sternocleidomastoid.
And floor and roof? Floor by the prevertebral fascia. Yes. Yes.
Okay, prevertebral fascia.
And the roof with investing layer of deep fascia. Can you please tell me how this posterior triangle is further divided in how many triangles and what are their contents?
The triangle is divided by the inferior belly of the omohyoid.
Yes.
The upper half of the occipitals contains the suprascapular nerve and lateral occipital nerve.
Yes.
And the spinal part of the accessory nerve.
Yes. And the lower half in the supraclavicular triangle, what would you find?
The transverse cervical artery and nerve.
Okay. Can you please tell me the surface marking of spinal accessory nerve?
It is across the posterior triangle of the neck.
Okay.
The junction between the upper two thirds of sternocleidomastoid. Yes. And the lower third of sternocleidomastoid to the junction between the upper two thirds of the trapezius and the lower third of the trapezius.
Okay. What type of nerve is spinal accessory nerve? Why is it what is the clinical significance of knowing this nerve?
It stabilizes the trapezius muscle and the sternocleidomastoid muscle.
Yes. And if this nerve gets injured, then what can happen?
The patient cannot shrug his shoulder and cannot move his neck to the contralateral side.
Yes. And shrugging and head. Okay, very good. Okay. Can you tell me the course of the spinal accessory nerve here?
The spinal accessory is across the posterior triangle.
Yes.
At the level of the upper two thirds of sternocleidomastoid and the lower third of sternocleidomastoid to the junction of the upper two thirds of the trapezius and the lower third of the trapezius muscle.
Very good. Okay. In muscular triangle, other than thyroid, what are the associated structures which are found there and they are very relevant? Can you name few?
The carotid artery?
No, they are in carotid triangle. Here you'll find superior and inferior thyroid vessels. Wait, let me tell you. Okay, recurrent laryngeal nerve, parathyroids, and thyroid membrane and larynx. So all these structures in muscular triangle are very important, especially recurrent laryngeal nerve, injury, everything, even parathyroids are there. So all these structures are very relevant.
Okay.
Very good. But if I would have asked you about thyroid, then that would have been another session. So today I'm not asking about thyroid. But one thing important, because I asked you about the surface marking of spinal excessive nerve. So there is a rule of third. Do you know about that? Can you?
Rule of third?
Rule of 1/3. Top
I
1/3,
don't know.
middle 1/3, and the lower 1/3 of the spinal
No,
excessive.
I don't know about it.
Okay, you can read that. Yes, that is important with the facial landmarks of the nerve. All right.
Okay.
If I would have asked you anything else. No, then that would have been thyroid if I would have. What is the inferior border of cricoid cartilage? Found at what level?
Cricoid at C6.
C6, very good. Can you name some important structures at the level of C6, vertebral level?
The vertebral artery ascend the liver of the C6.
Superior parathyroid gland, junction of larynx and trachea. Yes.
Okay.
Yes, and junction of pharynx and esophagus, middle cervical sympathetic.
Termination of the pharynx and beginning of the
Yes.
esophagus.
Yes.
Also termination
Yes.
of the larynx and beginning of the trachea.
Yes. Middle thyroid vein leaving the thyroid gland. Inferior thyroid, artery. Very good. Yes. Omohyoid muscle, spear belly, crossing the carotid sheath. Very important. And the level of carotid tubercle. Vertebral artery, you've already told me. So very good. Excellent. I think that's. Your screen is black.